Welcome, everybody, to the Nicholas Gonzalez Foundation's latest webinar. It's called Get Healthy, Get Pregnant. And this webinar is going to be led by Dr. Marina Yanover, and she's going to be talking to you about her credentials. So I will let her cover that as she gets started. But thank you so much for joining us so far. And we will be having a Q&A session at the end of this webinar. So for those who are attending live, you'll be able to ask your questions. We're also going to be sending out a link after this to the recording of the session. It won't include the Q&A session. So if you have kind of a private question that you don't want broadcast out onto the recording, you feel comfortable that we won't be recording the Q&A. Why don't we go ahead and get started? Dr. Yanover, if you could please bring up your presentation.
Today, we're going to learn how to guide you for preparing for a healthy pregnancy. So I'm going to be talking about some of the case studies here, and I'll be talking about some of my personal experience. So you'll learn a lot through this. Okay, so what I'd like to start with is I want to do a little imagery exercise. I want you to close your eyes. And the reason I want to do it is that we're going to get kind of into the mode of trying to relax and imagine what you'd like to learn from today's presentation. So close your eyes, breathe out 3 times, and imagine you walk into a garden with beautiful flowers. You walk through the gate. And you walk there, you can smell all the roses, the flowers, and you stop near a big tree with a shade. And it has a huge white trunk. So you sit near the tree and you lean on it. And you think about all the people who support you in your life, including people who are here with you and also people who are not with you anymore on this earth. And think about your questions and your concerns and ask these people, what is it that you need today? And once you got your answers, just think about this, take what you need, and let these people go. Once you got your answers, breathe out and open your eyes. So today's presentation will focus on how to make the right choices regarding your reproductive health. We'll talk about nutrition, detoxification, and emotional health. We talk about interconnection of physical and emotional well-being, why preconception matters a lot, and how to identify everybody's personal fertility factors, and also how the Gonzalez Protocol is applied to treat infertility and preconception, and how to apply the Gonzalez Protocol to get healthier before you get pregnant. I'll talk a little bit about the Gonzalez Foundation. The Gonzalez Foundation is a research education nonprofit group that was created to support Dr. Gonzalez's mission and educate people in nutritional enzyme treatment. The Gonzalez Foundation was founded in 2015, right after Dr. Nicholas Gonzalez passed away. And this is to educate the world and to continue the mission regarding the Gonzalez Protocol, which includes enzymes, nutrition, detoxification. And so right now we have doctors who practice the Gonzalez Protocol, and we are continuing the mission. Dr. Gonzalez primarily focused on treating cancer, but his protocol was also applied to treat a lot of different non-cancer conditions. And Dr. Gonzalez successfully treated all these conditions. And we, doctor who continue his mission, we also treat those conditions. And that includes Lyme disease, infertility, hepatitis, severe allergies, environmental illnesses, OCD, back and neck pain, IBS, lupus, heart disease, osteoporosis, and many other illnesses. If you are really interested in learning about Dr. Gonzalez's work, there's a book called Nutrition and the Autonomic Nervous System, and this is a really great book to read. This is something that probably many people claim is the best book of Dr. Nicholas Gonzalez, and because it details a lot about the autonomic nervous system and how it's so important in choosing your right metabolic type and how to apply it in terms of nutrition and all the other modalities. About me, I am Dr. Marina Yanover. I'm a licensed naturopathic physician and acupuncturist. Over the past 25 years, I've helped over 100 women get pregnant naturally without any medical interventions. One of the most remarkable aspects of my training is that I actually met Dr. Gonzalez and I had an honor to intern in his office. And I've learned a lot during this time. I've seen him helping cancer patients as well as other patients with different conditions. Dr. Gonzalez mentored me on many different illnesses, including infertility. My personal story, I'll tell you a little bit what happened to me. I got pregnant, but I didn't do detoxification, a lot of it, what needed to be done. I kind of did it on the surface. And what happened to me was I actually did lose a lot of blood during childbirth. My pregnancy wasn't very healthy. I was on bed rest for 4 months. And so if I have done everything right, I would have had different outcomes. Luckily, I incorporated a lot of my training and a lot of my knowledge, so I was able to make it better than it could have been. But looking back, I could have changed a lot of those things. I did not follow my metabolic type the way I should have because I didn't know it at that time. I also worked a lot. I didn't allow enough time to rest. I didn't take time for spiritual, emotional practices until I had to, until I actually went on bed rest. And so, yes, I don't want you to repeat my mistakes, and you should really learn from my mistakes. So this is, I included the picture of myself when I gave birth, and then I lost a lot of blood. 1 hour later, you can see how yellow I was. So that was really horrible at that time. They were talking about doing blood transfusion, which I didn't agree to. And luckily, I didn't have to do this. So what I've done right? I must have done something right because I was a naturopathic physician at that time. I took about 6 months, maybe a little more than 6 months to detoxify before pregnancy. It wasn't enough for me. I required more, but at least I knew to do this, and I detoxified a lot of heavy metals. I ate only organic food. I did follow advice from some of my colleagues, and I didn't follow the advice from the doctors that the advice did not feel right to me. I practice naturopathy to the best of my ability, in terms of doing the least invasive procedures first and then the most invasive procedures. So I one of the principles of naturopathic medicine is do no harm and practice the least invasive procedures first. And that's what I did. I also practiced in visualization techniques, and that helped me a lot during pregnancy. And also I did acupuncture treatments all the way throughout, before pregnancy, during, and after. So if I had to do it all over again, I probably would have taken a lot more time to detoxify before pregnancy. I would probably take 2 years to do it. I would also get my metabolic type straightened out, and I would follow my metabolic type. I would detox myself in a different way. Dr. Gonzalez's uh, recommendations for detox are a little bit different from what a lot of other integrative doctors recommend. For example, I did IV chelation. That's not something Dr. Gonzalez actually recommended to do. We do a lot of less invasive chelation procedures, which is actually better and works better on the body. I would also do, I would identify the potential toxins that I had, and I would target those toxins. And also I would connect with myself on a spiritual, emotional level prior to this whole thing, which is very important. These are my children today. So as you can see, good outcome, but it cost a lot of nerves and drama, which I could have avoided. So I'll talk about modern fertility challenges. So there's a lot of these days people talk about ADHD, autism, anxiety disorders, and developmental challenges that affect children today. And it's not just statistics, it's actually a reality. It's something that you see all the time. On the news, on the media, people talk to you about it, your friends talk to you about it. We know that um, 1 in 36 children is actually diagnosed with autism, and ADHD affects about 10% of children aged 3 to 17. We also know that another complication of pregnancy is something called preeclampsia and eclampsia. It's when the blood pressure goes up, liver enzymes go up, and the woman is forced to give birth prematurely, which is not something you want to do because you want to allow baby to fully develop in utero. The infertility rates are rising. 1 in 6 couples suffer with infertility and seek help for infertility, which is not like it used to be in old days. And a lot of times, women who already gave birth before and had some kind of pregnancy complications do not want to do it because they do not want to risk another bad outcome. The conventional medical approach is to rush into treatments without addressing root causes. It's all based on rush, 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 not thinking about what needs to be done to actually bring the woman to a better health. Oftentimes, women come to me and all the tests are normal. The conventional medicine offers quick solutions. Usually it's Clomid in the beginning, then it's IVF, and after that, women come back having experienced all these drugs in their systems, and they need to detoxify those drugs, and it has a lot of side effects. Women also lose themselves in the process, so emotionally they don't feel good from all of these treatments. So what are the main factors in preconception journey that we all need to keep in mind and consider? We need to think about genetics, but we'll talk about it later that genetics is not something that's, you know, there's nothing you can do about it. There's a lot you can do about genetics. It's not a fixed parameter like we used to think. There's environmental exposures. Diet and nutrition are very important, and emotional state. And also epigenetic influence. It's something that, genetic, again, is not like something that's set in stone. There's a lot of epigenetic factors that can influence our genetics, like we'll talk about it later in following slides. So genes are not all inherited. Our environment influences our genes, and the gene expression can be modified depending on what we do for our life. Our lifestyle also impacts the genetic expression. So environmental exposures, what are they? We have household products that we use that are not very clean. We have personal care items for cosmetics that have a lot of toxins and chemicals in it. We have food packaging that includes plastics and it has estrogen in it. Air and water quality, all of it matters. This is the picture of the Earth that used to look like from space in 2002 versus 2018. We can see how cloudy it looks from all the pollutions in 2018 in just very little time considering. Emotional trauma is something, it's a huge factor that plays role in infertility and preconception counseling. We need to look at childhood experiences, previous pregnancy losses, generational patterns, and current stress level, because sometimes everything is perfect. Somebody can eat a perfect diet, but there's still something that's not happening in their life. They may not get pregnant, and that's because of the emotional trauma that's still unresolved. I want to talk a little bit about diet and nutrition. Dr. Gonzalez played a huge emphasis on nutrition because the whole autonomic nervous system, which Dr. Gonzalez's protocol is based on, has a lot to do with nutrition. Why is nutrition so important? And why autonomic nervous system is so important? Because cells regenerate once you put them in the right state of balance. Healing is achieved on a deeper level, and the body gets what it needs in order to function the most effectively. So what is autonomic nervous system and who was Dr. Gonzalez? Let's talk about it now. So Dr. Gonzalez was an immunologist who treated cancer patients as well as patients with a variety of other degenerative diseases such as chronic fatigue syndrome, lupus, Lyme disease, different autoimmune disorders. During his immunology residency and fellowship, he met Dr. Robert Good and completed his research study, evaluated Dr. William Donald Kelly's aggressive nutritional cancer therapy. And so Dr. Good is considered the father of immunology. That was at that time president of Sloan Kettering Center. Dr. Gonzalez developed this nutritional protocol and practiced it ever since. And now we continue practicing his method. I'd like to talk a little bit about how the Gonzalez protocol evolved. There was Dr. William Donald Kelly, who was a dentist who started practicing his protocol because he developed pancreatic cancer, and because of his own illness, he developed this protocol that cured him from pancreatic cancer. Dr. Kelly also relied on Francis Pottenger theory and system regarding autonomic nervous system. So he based each nutrient interaction and each supplement interaction based on the autonomic nervous system theory. Dr. Francis Pottenger had this famous cat study that talked about the role of nutrition, which I'll talk a little bit about that later. And the autonomic nervous system is a system that has mainly two branches, the sympathetic and the parasympathetic. And so it's important to bring those two branches into balance. This is something that illustrates the importance of the autonomic nervous system. It shows the spinal column and different nerves coming out of it. So, and each of them are either sympathetic or parasympathetic. Just in a nutshell, what is autonomic nervous system? It is basically a nervous system that also can be named as autonomic, means automatic. So it directs heart rate, blood pressure, digestion, endocrine glands, respiration, and perspiration. It's something that happens without our control. That's why it's automatic or autonomic. Autonomic nervous system is divided into two main components, sympathetic and parasympathetic. And each of them has the opposite effect. So sympathetic nervous system is also can be called a fight or flight, which everybody I'm sure is familiar with the fight or flight response. It increases heart rate, blood pressure, it stimulates thyroid and adrenal glands. Digestive system turns off because during fight or flight, you don't want to think about digesting food. You want to run away and hide or fight. So the bowel movement slows down. The pancreas stops secreting enzymes, and the liver stops producing bile. It stimulates metabolism and causes breakdown of fat and muscles to produce energy. So people who are more sympathetic dominant tend to be more on the thinner side. They're more muscular people. The parasympathetic nervous system is rest and digest system. This is a system that helps us to slow down. It slows heart rate, reduces blood pressure. This is when you're in a calm state. At that time, you actually want to sit down and eat. It increases your hydrochloric acid, which helps you to digest food. It produces pancreatic enzymes, releases bile from the liver, increases intestinal movements, and also enhances the immune function. So two of these systems, the sympathetic and parasympathetic, they have to be in balance. So I mentioned before about the famous Pottenger cat study, and it's something very important to talk about because it demonstrates the role of nutrition and how nutrition can be such a great healing factor. So in 1930s, Pottenger completed this study. There were two groups of cats. One of the groups of cats, they fed them artificial food, and the other group of cats were fed raw milk and good nutritious food. The study traced those cats to several generations further. So the kittens of the raw milk group, they all grew to be healthy and strong cats with strong bones, strong teeth, and no illnesses. And kittens from the pasteurized milk and processed food group, they all had serious birth defects in future generations. I think he tracked them for 10 or 15 generations. So this study really demonstrates the importance of nutrition and how it affects future generations of children. So this can explain why, for example, people who baby boomers who grew up post-war, they were sort of depleted in nutrition. At that time in America, especially, the agriculture was changing. The pesticides were introduced. And so that's why the children now are being born with all kinds of problems. So we have a chance to change it if our children will be eating good diet, and starting from you, if you eat good diet now and take care of your health right now, and then eat according to your metabolic type, then teach your children to eat healthy as well, then their children will be healthy, and then consequent generations will be healthier and healthier. So it's possible to reverse that. I'd like to talk a little bit about some of my patients that were success cases. So one case is Brenda. She was 33 years old when she came to see me. She had a professional career. She has very interesting history. She was orphaned at the age of 15, and because her mother had tragic accident. Brenda spent 10 years working in textile factory, which, she just needed to survive. She needed a job to survive. Not too many people realize that textile factories rank like second only to agriculture in pollution. And a lot of people are exposed to all kinds of chemicals. Among those chemicals are polyvinyl chloride that's used in fabric sizing, chlorine bleach for color lightening, carcinogenic dyeing, flame retardant. So all of this is very toxic. And so Brenda also had emotional childhood trauma and lots of stress in her life, poor sleep patterns. She also presented with irregular cycles. So what happened was we put her on a treatment protocol. Her protocol involved nutritional therapy. We assessed her nutritionally, put her on the right diet that was right for her metabolic type. We gave her appropriate supplements also chosen for her metabolic type. We also did food allergy test, food sensitivity, and initially we eliminated a lot of foods that she was sensitive to because she had a lot of multiple chemical sensitivities. So she had to initially eliminate a lot of foods that she was allergic to. And also her diet was anti-inflammatory by its nature because she had a lot of inflammation patterns. She also did detoxification. We staged her cleansing program. We gave her liver support. She did liver flashes. She did detox, focusing on specific toxins that were found in her system. She also had heavy metals, and she did heavy metal detoxification. We also supported her on the endocrine level, did some hormone balancing with some herbs and supplements, supported her thyroid, adrenal. We do a lot of glandular therapies in the Gonzalez realm of protocol. We use glandulars to support the organs, such as thyroid for thyroid, derived from the animal thyroid gland, for example. Adrenal for the adrenal support, also adrenals derived from the animal adrenal gland. We also regulated her blood sugar because he had blood sugar spikes. And she followed everything. It took about 8 months for her to be on this program. We also did a lot of testings in the beginning. We implemented changes gradually to avoid overwhelming her system. And so her case really is a success case. Also, she did a lot of emotional work. I suggested that she does EMDR because she had a lot of trauma in childhood. So she did EMDR treatments. She did visualization therapy to heal childhood grief and did a lot of guided self-exploration, a lot of journaling. So yes, she did that as well. I also recommended acupuncture treatment, so she would come in during the follicular phase for weekly sessions, and then twice a week during the luteal phase, which is, a follicular phase is pre-ovulation, luteal phase is post-ovulation. And we did specific points in acupuncture for egg quality. If you know, I'm also a licensed acupuncturist, so I incorporate acupuncture in my practice as well. We also incorporated blood flow protocols for her acupuncture treatments. So this is what I call physical phase, like more on the physical body. And so the outcome was great. We regulated her cycle. We improved the egg quality. Her hormones were balanced. Her thyroid functions were much better. As far as emotional outcomes, she had a lot of emotional growth patterns. Her therapist was amazed with her progress. She improved sleep quality. Her anxiety reduced. She had much better stress management. So all in all, she's a success case. She did achieve natural conception. She had healthy pregnancy during the first trimester. It was all natural. She didn't have to use any drugs, and subsequent pregnancy was very healthy. She had normal genetic screening and a full-term delivery. So Brenda's case is really a powerful demonstration how comprehensive protocol can really be so helpful in achieving healthy pregnancy and how to achieve your own health before you even try to get pregnant. It took 3 years for her to get pregnant, but during those 3 years, she kind of at first didn't even try to do it, but she focused on her own health. And so after she created optimal health, then she started to try to conceive. And so she realized that this time that she didn't even think about getting pregnant, that time wasn't wasted. It was all done in order to achieve her final goal. And so she did. So she was 36 years old when she got pregnant, and she was very happy. Okay. I think she had a baby girl from what I remember. So yeah, that's a great success case. Okay, so Linda's story, that's the next patient. She was 41 years old when she came in, and her medical history was that she had two previous pregnancies, and during them she had preeclampsia. Due to preeclampsia, it's a condition when the blood pressure starts going up, the liver enzymes go up, and it's called toxemia. In old days, it was called toxemia of pregnancy. So the conventional method, usually they recommend to get the baby out, which means premature deliveries. She had two premature deliveries at 32 and 34 weeks. So she also had a history of insulin resistance, and her inflammation markers such as CRP and ESR, they were elevated. So her children, she has two children. from previous pregnancies. They had learning difficulties, they had chronic allergies, and some sensory issues. Lynn believed that once you had this type of complications in previous pregnancies, that would mean that she would also have problems in consequent pregnancies. So she came to see me thinking that maybe she shouldn't even try to conceive again because she had all this history. But she really wanted to have another child, and she was determined to create a different outcome. And so she got on a protocol. So this is what we did. We completely changed her diet to organic, non-GMO food. Um, we did systematic detoxification protocols. We did weekly acupuncture sessions to balance the nervous system. By the way, acupuncture also helps to balance the sympathetic and parasympathetic, the autonomic nervous system. And we gave her targeted supplements to address in both environmental exposures as well as to balance the autonomic nervous system. We also reduced her toxic load. And so, as an outcome of that, Lynn had a healthy pregnancy, no preeclampsia during that pregnancy, and a healthy baby boy. So that's an amazing story as well. Her blood pressure was throughout the whole pregnancy, her blood pressure was 115 over 75. That was her average blood pressure. She had normal liver enzymes throughout the whole pregnancy, which was unheard of with her previous history. She had healthy kidney function, which was also a problem before. Her inflammation markers were normal and normal placental development. So that's like, to me, that's a miracle as well. She had no protein in the urine, normal weight gain. She didn't gain a lot of weight abnormally, a lot like she did before. Term delivery was at 39 weeks, which was 39 weeks is considered full term, basically, and natural labor and delivery. So no C-section, didn't need to do this. So the baby was normal baby weight, excellent APGAR scores, successful breastfeeding. So everything was normal and healthy. And the baby met all the developmental milestones. And as far as I know right now, the baby is probably 7 years old. He's probably 7, I think, years old. And from last time I spoke with her a few months ago, he's totally healthy and no problems. So again, Lynn's case demonstrates that age doesn't matter. What matters is health. And once she addressed her health, she detoxed herself. She ate right for her metabolic type and took right supplements and really balanced her autonomic nervous system. The age didn't matter. She had much better outcome when she was older comparing to when she was younger. So the key takeaways from this case is that taking care of your health before pregnancy is crucial. You need to prepare at least 3 to 6 months, but better 1 to 2 years. 3 to 6 months is if you are absolutely healthy. 1 to 2 years is really what most people need today. You need to address root causes, and you need to integrate multiple approaches. It's not just one approach. It's always integration. It's always diet, supplements, detoxification, addressing emotional causes. It's all together is when it really works. And of course, it's very important to keep in mind that everybody is individual, everyone is different, and you need to address you need to address everything depending on the person. There is no two people alike, and everybody will have a different protocol. So I want to tell you that I gave you two successful cases, but sometimes, not every patient is a candidate for this protocol, because what's important is patient's commitment. This is the type of protocol where the patient is the one who really does this protocol at home. The patient needs to be committed. The patient needs to make right choices and eat right and do detox, and do everything. And it's not something that you go into doctor's office, get into the IV chair and get your vitamin drip. This is not like this. This is something that you really, really need to put a lot of effort into it. A comprehensive approach, again, addressing multiple factors is important. Emotional support is very important, to have people in your life who support you. And that's why we did that little meditation in the beginning of the presentation, because I wanted you to really connect with those people who support you. And it's so important to have people, like right-minded people who surround you and who will be participants in your journey. And professional guidance is also important. It's important to work with a doctor who knows this, and who can guide you through the journey. So for the future, it's important to understand that, what it does on a great scheme of things is that it fixes your health from inside out. It's not just about fertility. It's about taking care of your health on many different levels. It's also generational wellness. You're not only taking care of your own health, you're taking care of your children's health and giving them great start to start their life healthy. And so then they can pass on this health to their children as well. And so the chronic disease risk will be decreased in subsequent generations. And of course, the child will be developing normally and healthy. So this is something that we are doing. It's not only affecting you, it affects health of your children, their children, your grandchildren, and so on. So hopefully we are reversing the whole genetic lines here and making everyone healthier and stronger. So I want to talk a little bit about biological clock, because I hear this a lot from women who come see me, and this is a real thing. And I was also so nervous about this when I was trying to get pregnant, and so this is something we hear in the media and in the news from people, from relatives, that you only have certain window of time while you can get pregnant, and then that window of time goes away, and that's called biological clock. Fertility is not determined by age alone. Health is what's important, and so multiple factors influence your fertility. Health is something you really need to focus on. Just keep that in mind, and it's your physical, mental, emotional health. While age does offer certain advantages, it's not everything. And removing your toxins from your body, and fixing some of the emotional traumas is far more important. So let's talk a little bit about toxins, because I did mention quite a lot about toxins in this presentation. So I want to talk about it. What is toxins, and why do we have them, and what is it? So today, we live in this world that is surrounded by toxins. The Industrial Revolution is something that brought a lot of toxins into the environment. And, we were able to eliminate one thing by developing antibiotics. We were able to eliminate pathogens to some degree. But then the whole another wave of another problem came in, and that's toxins. And so toxins are everywhere. They're in the air, they're in the water, there's pesticides in the food. So what can we do about it? We cannot isolate ourselves, of course, because we are surrounded by it. But what can we do? So first of all, we need to assess. Some people accumulated more toxins than others. How can we determine whether we have those toxins or not, or at least to what degree? So there are certain symptoms that indicate toxicity. For example, fatigue. Fatigue is one of this. If you feel tired a lot, if you feel like you're waking up in the morning tired and your energy is low throughout the day, that's one of the symptoms of toxicity. Depression, insomnia, that's another one. If you have allergies, if you have environmental allergies, or if you have food allergies, any kind of allergies is usually a symptom of toxicity and a symptom that your liver needs help. Also, headaches, that's another symptom of toxins, and digestive problems. So, if you have any of these symptoms, you probably have toxins that need to be removed. So when I see a patient, I do my assessment to figure out if they have toxins and what kind of toxins. I do it through tests, but I also do it in the beginning when I see a patient, I do it through intake and asking questions. So a lot of my questions include dental history, particularly focusing on mercury fillings. Also current conditions, housing conditions, like age of the house, inspections for mold, asbestos, radon, vehicle replacement history. For example, new cars off gas formaldehydes for approximately 3 years. So if somebody is changing their cars constantly because they want to drive a new car, they're constantly breathing formaldehydes in their car. Also, home furnishing choices, carpeting, furniture materials, that's all very important. Also, I ask people if they lived abroad, because if they lived, for example, in China, that also a lot of times could correlate with arsenic exposure. So that's something to keep in mind. So do you think that by eating all organic foods, you'll be able to isolate yourself from toxins? Of course not, because we are all surrounded by it. So of course, we need to eat as much organic as possible, but we also need to design some kind of system that will help us to get rid of these toxins little by little. If we don't, we're just going to get sick and pass it on to our children. And so the Gonzalez Protocol is the perfect protocol to address this issue. So let me tell you a little bit about the Gonzalez Protocol, what it involves. There are three main components in the Gonzalez Protocol: individualized nutrition, individualized supplementation, and individualized detoxification. All three components are very important and need to be done simultaneously. One cannot be done without the other two, because that's the whole beauty of this protocol. Otherwise, it will not work. I want to give you a little bit of example how we are all different, because the Gonzalez protocol is highly individualized. So some people, for example, need to be mostly vegetarian, and some people need to eat a lot of meat. Every day meat, even 3 times a day for some people. And one of the examples is Professor Stevenson, he was an anthropologist. He went to the Arctic Circle to study Eskimos. And he said that in that group, people, Eskimos who lived in the Arctic Circle, these were the healthiest people. All they ate was meat and they were thriving on it. They had no cancer, no heart disease, no diabetes. And so that just demonstrates that when people were in their right environment, eating their right food, they were thriving there. And so that history, what other people before us discovered, that just shows the relationship between that data and today's illness. Today, people moved, people don't live anymore where their ancestors used to live. And so we really need to fix that and find our right metabolic type and start eating the way our ancestors ate. And because everybody is from different areas of the world, it's hard to tell what your metabolic type is. And the metabolic type really helps to bring you into the state of balance. If we balance the autonomic nervous system by finding the right diet, knowing the appropriate supplements we need to take, we can overcome all the illness, plus adding some detox procedures to it. So what is individualized nutrition? Again, it's based on our genetic differences, the climate we live in, or the climate we used to live and grew up with. And we cannot be all the same. So only few doctors that were trained in the Gonzalez Protocol know how to really metabolically type people. And so we rely on certain tests, detailed history, physical exam, and so we are able to actually tell you what metabolic type you are. Individual supplementation also supports that theory, and once we know the metabolic type, we are able to tell you exactly what diet to eat and what supplements to take. And then the detoxification is so important, again, because we live in a toxic world and we need to detoxify, but not every detoxification procedure is good for everybody. Again, it will depend on your metabolic type and what would be good for you. For some people, for example, we modify detox procedures. And so not everyone gets the same detoxification. Some people, for example, feel great in a sauna and others don't. So we need to balance that with metabolic type as well. But most of the detox procedures do include coffee enemas, liver flash, and colon cleanses. That just, but the details vary a lot. Also, the detox procedures include various forms of baths, skin brushing, and exercise. Okay, so I want to talk a little bit about how to become a patient. If you're interested to become a patient on the Gonzalez Protocol, what you need to do. It's a great protocol, but you can't just, if you decide you want to follow it, you need to go through certain procedures because, again, this protocol is very unique in a way that if you do what needs to be done, then you'll be successful. If not, not so much. So there's a selection process in order to become patient on the Gonzalez Protocol. So you need to fill out an application and go through an interview so we can determine if you are the right fit for this protocol. So once you fill out this application, you can go on the Gonzalez website, and I think, yes, here is the website on the bottom here, and you can apply. and then schedule an interview and we can determine if you're the right fit. I also included my website here, www.bigAppleHealth.com, our phone number here, 203-255-5005, if you have any questions or if you need to contact me. I'm gonna tell you a little bit about the Gonzalez Guardians. I'm the guardian. So the guardians are the doctors who continue the mission of Dr. Gonzalez. So we are trained in the Gonzalez Protocol, and we hope that there will be more and more of us guardians who will help heal the world. The doctors are mostly medical doctors and naturopaths, and we are here in US, in Mexico, in Jamaica, UK, and Turkey. This is a website here in red where prospective patients can apply. I also want to talk about the cookbook that Mary Beth wrote. She wrote a beautiful cookbook that includes 150 healthy recipes that's divided into different metabolic types. There are recipes for vegetarians, recipes for meat eaters, and they are delicious. So if you want to get this book, you can go on this website, newspringpress.com, or you can get it straight from the Gonzalez Foundation website. And these are the links again, how to get in touch with us. And now, if you want to ask me questions, I am here.
Oh my goodness. I just want to say thank you, Marina. You did such a beautiful job. I I'm I'm so thankful that you were able to share your expertise and over 100 people that you helped uh, get pregnant and deliver healthy babies. That's just phenomenal. Congratulations.
Thank you.
We have a couple people who are on with us right now, and I asked them if they had any questions, and I haven't gotten any posted yet. So let me just turn off the recording now.